Matthew Lovett. I serve as the Peer Policy Fellow with the National Alliance on Mental Illness, or NAMI Texas. I'll be emceeing today's event, but more importantly, we've got an amazing lineup of advocates, mental health professionals, and policymakers here to share their experiences with mental illness, supporting others living with mental illness, or crafting legislation that improves access to and availability of mental health care. But first, NAMI Texas would like to recognize our event sponsors, AbbVie, Otsuka, and Neurocrine Biosciences. Their generous support has been instrumental in our ability to gather here today and support advocates from across the state to organize and connect with their local policymakers. But more on that in a minute. For those of you who are new to NAMI Texas, we are a nonprofit 501c3 organization with 27 local affiliate organizations and approximately 2,000 members. Simply, our mission is to help improve the quality of life for individuals living with mental illness, as well as the lives of their families. One way we hope to accomplish this is by empowering our local affiliate members to participate in policy advocacy. Normally, this would include in-person advocacy training and legislative outreach. That couldn't happen this session for obvious reasons, so we organized a series of virtual meetings for advocates to connect with their local policymakers, which we dubbed Days of Action. And let me say, the mental health advocacy community really showed up. Excluding our fourth day of action, which follows this rally, over 150 advocates met with 45 legislative offices to share their stories with mental illness, identify gaps in the mental health care continuum, and advocate for specific policy solutions. We plan to pad those stats a little bit this afternoon, but clearly, NAMI Texas Days of Actions have been a huge success. Which brings us to today, gathered to celebrate our efforts to demonstrate what can be done when we #Act for Mental Health. The mental health system in Texas has many different facets, including early intervention, criminal justice, insurance coverage, medication access, and housing and employment support services, amongst others. In order to improve the mental health of Texans, everyone needs to be able to access the appropriate services and supports. Unfortunately, there exist many barriers to services that jeopardize our individual and collective well-being. Accordingly, NAMI Texas affiliate leaders have come together to create a quick video that we believe captures a few of our policy priorities to address these concerns. We'll play that for you shortly.
Since the close of the last legislative session, our state and our sense of normalcy have shifted immensely.
Even before COVID-19 came into our lives, we were gripped by a mental health epidemic deeply affecting communities across Texas.
The physical, mental, and economic consequences of COVID-19 have exacerbated the mental health crisis impacting communities all across Texas.
NAMI Texas affiliates are resolute in our belief that mental health must be a top priority.
We support increased funding for outpatient care. Failure to invest in these services is penny wise and pound foolish.
We support investments in psychiatric hospitals, supporting a continuum of care. No one should have to wait in jail for mental health care.
We support early mental health intervention for children, adolescents, and their families. People with other conditions get access to early care.
But on average, individuals with mental illness wait 8 to 10 years to receive the services and support they need.
When we #Act for Mental Health and invest in evidence-based services, individuals avoid negative outcomes like criminal justice involvement.
40% of prisoners and jail inmates have experienced mental illness. Mental illness is not a crime.
Texas must act for mental health to support engagement and services prior to the criminal justice system. Our jails and our prisons should not be our largest mental health facilities. We need care, not handcuffs.
1 in 5 adults experience a mental health concern in a year, and expanding insurance coverage is an important step in increasing their access to care.
Mental illness can contribute to housing instability and homelessness.
Texas should invest in housing, ancillary supports, and community-based services across the state.
Members of vulnerable and marginalized communities often experience barriers to accessing mental health care.
Targeted interventions that reduce disparities in access can improve the mental health of those most in need.
A strong response to a mental health crisis is critical to starting a person down the path to recovery.
Texas should develop a coordinated system across the state for mental health crisis and suicide prevention calls.
It has never been more important for the Texas legislator to act for mental health.
Across the state, the 27 local NAMI affiliates stand with NAMI Texas in advocating to better the lives of people affected by mental illness.
To reiterate, we believe that every individual who needs mental health services and support should be able to access appropriate, affordable, and timely care. To achieve this goal, NAMI Texas supports investment and promotion of early intervention, a mental health responsive criminal justice system, robust access to health care and coverage, appropriate housing and supports, a strong system capacity and workforce, targeted interventions directed at those facing disparities, and a crisis response system that is better able to help individuals and families on their road to recovery. Toward the end of the rally, I'll provide a legislative update that covers how we've been able to improve the mental health care system in Texas during this legislative session. But first, I'd like to introduce Anna O'Quinn, who will be introducing today's speakers. Anna?
Hi, everyone. I'm so thankful to be here with you all virtually this morning. My name's Anna. I'm a graduate student of social work at the University of Texas. And I'm also the policy intern at NAMI Texas. My main focus this session is working with youth and child mental health policies. I also serve as the graduate assistant with the Texas Child Health Access Through Telemedicine, or TCHAT program, which you will have the opportunity to hear about later in our event. We're so glad you're all here with us.
Hey, Anna. Representative Theory is not available at this moment, so let's go ahead and skip down to, we'll start with the video of the other elected officials.
Perfect, great. Thanks for letting me know, Greg. We will start then with Senator Whitmire and Senator Eckhardt. They have both graciously offered to show us a video to provide recorded comments on mental health and mental health policy in Texas.
My name is John Whitmire. I'm a state senator from Houston, Texas, and thank you for the opportunity to show my support for the National Alliance on Mental Illness of Texas. We all know what an important job that the Alliance carries forward. And I can't be with you today, I'm traveling, but let me encourage you to talk to your state rep, your state senator. There's so many things relate to someone's mental health. The Capitol talks about the homeless issue. What are we going to do about homeless individuals? Well, the first thing we can do is make sure that they have mental health services. So many of our homeless find themselves dealing with mental health issues. So let's see that mental health gets the priority that it deserves. Let me know how I can help you. We've got to better fund our programs. But more importantly, we've got to all come together and say, let's make mental health services a high priority. Thank you, and be safe traveling.
Hi, I'm Senator Sarah Eckhardt. I represent most of Travis County and all of Bastrop County in the state Senate, and I am so happy to be here with NAMI. NAMI is my go-to source for quality information and advocacy on mental health care at the state level and also nationwide. I know I'm preaching to the choir when I tell you that we absolutely must improve our health care in Texas for every Texan, including mental health care. It is long overdue that we move mental health care out of the criminal justice system and into the healthcare system where it belongs. But in order to do that, we're going to have to do a lot of reforming of both the healthcare institutions and the criminal justice institutions. So Thing one, Medicaid expansion. I know I'm preaching to the choir, but let's stay the course, stay focused, and not allow the Texas legislature's attention to wander. We need to repatriate that Medicaid money so that more Texans will have the health insurance and the access to health care that they need. Thing two, criminal justice reform. We could do that this legislative session. We could change the way the criminal justice system addresses people who have mental health needs, particularly substance use disorder. We could do that this legislative session if we stay focused and we don't allow the Texas legislature's attention to wander to other things. So I'm going to highlight a few bills in the Texas legislature that I know you will support. Several of them are mine. Senate Bill 947, the Good Samaritan bill. We've tried this before. When somebody overdoses and you're with them, we want you to call 911 right away without fear of being prosecuted. So the Good Samaritan bill is designed to do that. Overdose deaths have surged in the midst of the pandemic, with more people dying in the past 18 months since the opioid epidemic began 30 years ago. So, Good Samaritan bill, Senate Bill 947. Senate Bill 1844 for diversion data collection. This bill would require law enforcement to collect data on their interactions with individuals who are in mental health crisis. By collecting and reporting critical data, we will have a better understanding of how we can create better outcomes when our criminal justice system does encounter somebody who is in a mental health care crisis. My Senate Bill 944, medication continuity. When an individual has a medical regime for their mental health disorder, we want to continue that behind bars. So this bill would require that jailers continue the medical regime that's been prescribed to these individuals. That would be very important to keeping them stable and also keeping law enforcement safe. Also, my Senate Bill 1346, Office of Forensic Services. An Office of Forensic Services would help get us to a better place with developing best practices and supporting local initiatives to improve competency restoration services for individuals. Competency restoration services is not full spectrum mental health care. It just gets you stable enough to meaningfully participate in your own defense. We want to make sure that we definitely at least get people stable enough to meaningfully participate in their own defense as quickly as possible so they don't spend inordinate numbers of days in jail even before ever being adjudicated just because they need some assistance getting to that place where they can meaningfully discuss their case with a defense attorney. Also, there's some great bills by other individuals. Senator Blanco has Senate Bill 228, which I've signed on to, that assures telehealth reimbursement parity. That's a great bill to advocate for. And then, of course, there's Senator Nichols' Senate Bill 5. I am a huge proponent of expanding broadband so that we get better access to all kinds of health care, but most especially mental health care. And Senator Nelson has proposed Senate Bill number 5. It has broad support, and I think we should all get behind it because expanding broadband is crucial to reaching people that may not otherwise be able to access care. So those are a few things to advocate for, but really top line here is expand Medicaid and reform the criminal justice system, particularly for individuals who are suffering with mental health crises and substance use disorder. Thanks so much for everything y'all do.
Although Senator Eckhardt and Senator Whitmire couldn't be here in person, we are very much appreciative of the time and energy they have put into advancing policies that increase access to mental health services in Texas. Next up, we'll be lucky to hear from a few people with lived experience with mental illness, people who are family members of people with mental illness, and those who provide mental health services. First up, we have Jennifer Toon. Jennifer is a criminal justice and mental health advocate currently working at the Coalition of Texas with Disabilities as a mental health peer policy fellow. She's deeply passionate about early childhood mental health and school discipline practices. Jennifer aspires to create policies that lead to better mental health support for kids and eliminates all punitive practices that punish students for behaviors that are manifestations of disability or trauma.
Thank you so much. I'm really honored that NAMI asked me to participate today. The work I do at CTD it's not just work. It's a life's passion. The stories that we hear about student mental health supports failing, stories of kids funneled through the school to prison pipeline. These stories affect me deeply because they're stories much like my own. I am a person with a mental health condition, which left untreated results in severe crisis situations. I was 15 when I first entered the criminal justice system. And, you know, I think back to all the red flags and the warnings and the missed opportunities prior to my offense, how stigma and denial really played a role in the lack of intervention. School was where my behavior and my struggles first manifested. That's where it really was noticeable. And I remember going through my trial and my attorney telling me that there were several teachers that had wanted to testify to say that they knew something was wrong, but they didn't know what to do. And especially back in the early 90s, when children were just deemed as super predators when they acted out, you know, they didn't have the tools and they didn't have the training. And I think about how different my life would be, how different my life would have turned out if one of those teachers would have intervened before that moment of crisis. So I went to prison for 10 years. I didn't get any real treatment then. And a lot of times during that first incarceration, my family, you know, they did the best they could to support me, but there's such a stigma with mental health issues, especially growing up in rural East Texas. So it was more of a, you know, honey, it was a one-time thing. We're better now, and let's just move on. And certainly TDCJ, the Texas Department of Criminal Justice, did not have effective mental health treatment. So I emerged as a young adult 10 years later, going to college and working at a nonprofit doing peer health education. But the same stressors that occurred when I was a teenager began to manifest again. And I didn't know what to do. I didn't know who to reach out to. I tried to contact a therapist, but I still didn't completely understand what was happening to me. And I ended up in another crisis and went back to prison for another 10 years. And it wasn't till the end of my sentence that I was offered some substance use treatment, which it's very strange that mental health treatment was very separate from that, which, you know, they go hand in hand. But I utilized what was given me, and I utilized the things that were given to me in the community the best I could. I had to learn to become my own self-advocate. Again, going back to rural East Texas, there was just not a lot of options. You know, I'm better. I'm my best self. But I'm going to tell you, every day is still as much as a struggle as it was when I was 15, but I have the resources, I have the knowledge and the treatment that helps me be stable and do the work that I do. Because I do the work that I do to make sure that no other child has to go through what I went through, and also for my own recovery. So anyone that's watching, listening, if you struggle with mental health conditions, you know, just please know that there's hope and there's resources. And I'm really proud of the work that we do at CTD and really excited to be a part of today's discussion with NAMI. So thank you for having me.
That was incredible. Thank you so much, Jenna, for sharing your story with us. Next, we have Donna Fagan. Donna is a parent to 4 adult children and 7 perfect grandchildren. She and her husband, Bill, are currently parenting 2 grandchildren. Donna has been a NAMI member for about 10 years. She teaches NAMI classes, leads faith-based support groups, teaches mental health first aid, and works as a certified family partner in a community mental health program. She's a mental health advocate and sits on a number of committees at the state and local level, providing input for improved and expanded mental health services and the inclusion of family voice in all systems.
Thank you, Anna. It's a pleasure to be here with everyone this morning. Thanks to NAMI and the legislators that have made themselves available for this event. I'll tell you a little bit about myself. My husband, Bill, and I are the parents of 4 adult children, 2 of which had mental health conditions. And we're now parenting 2 grandchildren, one with a serious emotional disturbance. But I'm here today to tell you that recovery is possible. My oldest daughter developed her mental health condition during a period of time where support was nearly non-existent. In San Antonio in the 1980s, there was 1 child psychiatrist, and appointments were being scheduled as much as 1 year out. At that time, special education services for children with emotional disturbance had not become law. Initially, we found no one to help us. My husband, Bill, and I have been NAMI members for about 10 years, and I have taught many NAMI classes and have led faith-based support groups. This last decade of my family story began in 2010 with the loss of our 21-year-old son to suicide. People from our church, Community Bible Church, and NAMI San Antonio were there to provide support and help us through that most difficult time in our lives. Faith-based organizations and organizations like NAMI stand in the gap to help individuals and families as we wait and advocate for mental health services that are so desperately needed. At the loss of our son, we knew we didn't want to see another family experience the kind of challenges we had experienced. There is a lot of stigma around mental health conditions and suicide. We sought to hold our family together, and even though we found it difficult to talk about our challenges, we determined that we would talk openly. I said, this is where the problem stops, and I want change to come within my family, and I don't want others to experience the same things that we've had to experience. The story of my family's mental health is ever evolving, and services which were non-existent are now available in many counties in Texas. But of course, more needs to be done. I'm extremely grateful to our legislators and others at the state who have every year listened to our concerns and expanded and added additional much needed services for individuals and families. But again, I'm here to share recovery is possible for all individuals. We need support from our communities, but also from within the systems, agencies, and organizations that serve us. Families are diverse and have diverse needs, but families are families, and we embody the culture of family. Within our communities, whether it be a rural county, inner city, metropolitan area, or suburb, families need support from other families, not just in churches and organizations like NAMI, but also as providers of peer services within all child-serving systems. These roles should be paid roles and have the highest level of respect from individuals in that organization. Cultural competence, cultural responsiveness, and cultural humility demands we listen and act on the needs and requests of families. Cultural humility is, I have something to learn from you. How can systems know the needs of families within our diverse communities? By listening to hear our concerns and by having family voice at the table in all levels of decision making. One of the most culturally competent things an agency or organization can do is provide peer support, adult peer support, youth peer support, and family peer support as a service that is easily accessed and immediately available. I currently work as a certified family partner within a local mental health authority. A family partner is a person with lived experience as the parent or legal guardian of a child or youth with a mental health condition. I am a formal member of a child or youth's treatment team. I provide direct services to the parents of children by providing emotional support, sharing my stories of lived experience, and helping the family navigate services in our agency and in other child-serving aid systems. Our state, like many other states, has a behavioral health workforce shortage. And we pass that off as if there's nothing that we can do. A statewide strategic behavioral health plan identifies several gaps in services. Among them is Gap 8, peer services. There is a peer workforce within the state of Texas that can step into these roles. There's still time this legislative session and again in future sessions to advocate for bills that support mental health and peer support. Two of those bills this year are House Bill 4265 and House Bill 1413. I encourage everyone to call your legislators and ask for these bills to receive a hearing. Services have come a long way since my family's lack of treatment options in the 1980s. And we express our deepest thanks to legislators and others in Texas who every year provide additional funding and services. Again, I believe that recovery is possible, but families need recovery too. And one of those things that we can do to support families in recovery is to provide family peer support providers, certified family partners in all agencies and organizations in the state. Thank you.
Thank you, Donna. Your story and your advocacy are an inspiration to us all.
Thank you, Anna.
Our next speaker is Anne Grady. Anne Grady is a best-selling author, two-time TEDx speaker, and the mom of a child with mental illness and autism. Anne has become known as a leading expert on resilience, emotional intelligence, and leadership, contributing to Harvard Business Review, Entrepreneur, Fast Company, Fox Business, and many more. You're welcome.
Thank you so much, Anna. I appreciate it. So my question is, what do you do when the person that you love more than anything in the world tries to kill you? And what do you do when that person is your 3-year-old son? My son, Evan, turned 18 6 days ago and will be graduating from high school in June. He's been hospitalized multiple times. He was on his first psychiatric antipsychotic by the time he was 4, and we could find no treatment. We were on waiting lists for months to get to see a psychiatrist. We struggled to find helpful resources within the school. And when Evan was 7 years old, he was placed in his first pediatric inpatient unit in Dallas. When he had been there a week, we were told our insurance company would no longer be able to continue treatment. And we begged and pleaded and were able to get 2 months, but Evan was far from better. We were just told that there were no more resources. Again, when Evan was hospitalized when he was 10, and the same thing happened. And again, we had a child who was now discharged, who was completely unstable. Most recently, 2 months ago in February, Evan had an episode because his medication that was working was now no longer covered by Medicaid. Our insurance company would not cover it because of the cost, and Evan spiraled. We were told that the only way Evan could get treatment options and help in Texas was if he offended and received those resources from the Texas jail system. Evan has been on a waiting list for 14 years to receive treatment options and resources from the state of Texas, and we are still 30,000th on the list. He will be receiving services starting day 1 if he lives in Idaho. So we have made the gut-wrenching decision to have our son live thousands of miles away from us so that he can receive the mental health treatment that he needs. He'll be able to move into a new home, have roommates, 24-hour-a-day staff, all of his medication, therapy, psychiatry will be covered, resources to help him join the community, find a job, and be a productive member of society. And I'm telling you, as a parent, as a mental health advocate, it's not acceptable. We have to do better for our kids who turn into adults and end up in the system and just stay there. Thank you so much to all of the legislators, all of the panelists, everyone from NAMI for all of the important work you do. It's so important that we make this a priority. Mental health is not just the absence of mental illness. And if COVID has taught us anything, it's that we have to do more. And I am begging and pleading with you to please make this the priority that it needs to be for Evan and everyone else struggling with a mental health condition. Thank you.
Thank you so much for sharing with us, Anne. Your story is really a powerful testament to the need for improved access to services. We're so thankful for your story and your work. Our final speaker is Dr. Nithyanwani. Dr. Mani is a board-certified child and adolescent psychiatrist at UT Health Austin, pediatric psychiatry at Dell Children's. And she's also an assistant professor in the Dell Medical School Department of Psychiatry and Behavioral Sciences. Dr. Mani is Associate Director of the Child Psychiatry Telemedicine Program at Dell Children's Medical Center. Her clinical interests include providing comprehensive and compassionate care for children and their families through outpatient work and collaborative care models.
Thank you so much, Anna, and thank you so much, Donna and Jennifer, for your powerful stories. As Anna said, my name is Dr. Mani. I am the Associate Director of the CPAN and TCHAT programs at Dell Medical School, and I am so excited to be here today because every day I see the importance of mental health care. CPAN, which stands for Child Psychiatry Access Network, and TCHAT, which stand for Texas Child Health Access through Telemedicine, are funded through SB 11 and are designed to increase access to mental health care for children. We partner with the PCP, the primary care provider, and with the schools to provide virtual short-term stabilization and urgent assessment for children free of charge. Through our TCHAT program, we recently saw a 14-year-old girl who was struggling with depression and anxiety. She was not able to participate in school. She was not able to engage in any of the support that her family was able to offer. To put it very, very simply, she was really, really struggling. As she was waiting to be connected to psychiatric care, her symptoms continued to worsen to the point that she was in crisis. Her school reached out to us because she was having thoughts of hurting others. She was emotionally detached from her family, from her friends, and everyone in her life. And the tipping point was she was found barricaded in a room with a knife, threatening others. This child had insurance, but it had a very poor mental health coverage plan, which left her family at a loss. They either had to pay out of pocket for an urgent appointment with a psychiatrist to evaluate the needs of this child, or take the child to the emergency department for an evaluation. She was able to work with her school to come up with a safety plan, but they weren't able to do anything beyond that. They reached out to TCHAT, and through our program, she was able to get a same-day crisis assessment within a few hours. She was able to schedule a visit with a child psychiatrist within a week, and she was able to be seen by one of our pediatric psychologists for short-term stabilization. The family didn't have to pay anything for these services, nor did they have to wait for months for their child to receive the care that she needed. We were then able to get her connected to community providers to ensure that this child had ongoing care. As you've heard from some of the people speaking today, if this service was not available, the outcome could have been very different. In collaborating with the child's primary care provider, with their school, with their family, we're able to bring these interventions into the child's world. We see them virtually, so often we see them while they're at home, while they're in their classroom. So not only do we make this healthcare accessible to them, but we also collaborate with the people that they interact with and on a day-to-day basis. I was really struck by something that Jennifer said around the fact that a lot of the teachers she was interacting with could tell something was going on and could tell that she needed that help. And that's where we're hoping to intervene. Those teachers are able to reach out to us so we can collaborate with them, we can understand what's going on, and we can create lasting change. Through the funding from Senate Bill 11, we are changing the course of these young children's lives. The mental health burden on children is continuing to grow day by day, and we have to do something. Ongoing funding for programs that increase access to mental health care is imperative because we're not just helping children right now, we're shaping the future of our country. So as a child psychiatrist, my dream would be that when I introduce myself and when I talk to someone for our intake appointment, they don't tell me that they've waited months to see me. I really wish that that was not the case every single time I sit down to speak with a patient and their family. I became a psychiatrist because I saw the suffering psychiatric illness caused, but also because I was really hopeful to see that the lasting, lifelong impact an appropriate intervention can have. We can treat these illnesses. Mental health care can alter the whole trajectory of a person's life, but everyone needs to have access to it. So I really appreciate all the work that NAMI has done in this effort, because we really, really need to make sure that we have appropriate access to mental health care. I appreciate all of your time, and thank you so much.
Thank you, Dr. Mani. Such amazing and collaborative work you're doing with CPAN and TCHAT. We cannot thank you enough, Jennifer, Donna, Ann, and Dr. Mani, for sharing your stories and experiences. They are so helpful in advocacy and so valuable to mental health work. I'm going to pass it back to Matthew for a brief overview of a few of NAMI Texas's policy priorities for the remainder of the session.
Thank you, Anna. And to your last point about advancing policies that increase access to mental health services across Texas, we would like to take this opportunity to provide a legislative update on NAMI Texas policy priorities. Let's see if I can get my video on the screen. I can't see myself, so maybe there's a way to do this. Oh, there we go. And before I proceed and provide that legislative update, I wanted to say real quickly, thank you to Representative Theory, who wasn't able to make it today. She was on the call, but had to step away to present a bill on the House floor. So unfortunately, that took precedent over being here today. Hopefully, she will be able to participate in future NAMI Texas Advocacy Day advocacy opportunities. That said, with respect to a legislative update, first, NAMI Texas championed multiple bills related to medication access, medication continuity, and insurance coverage parity this session. We've got 5 such bills waiting in House Calendars Committee right now. Briefly, these bills try to resolve concerns with fail first and prior authorization protocols, non-medical switching, and coverage parity for individuals living with mental illness. The 5th bill improves access to essential medications for justice-involved individuals who receive competency restoration services through the state hospital system. Senator Eckhardt mentioned that bill previously. If and when these bills are voted out of calendars, they would hit the House floor for debate and then move over to the Senate side. In addition to medication and coverage-related legislation, a couple NAMI Texas championed bills related to the criminal justice system have received committee hearings. One would require peace officers to collect certain incident-based data pertaining to jail diversion for individuals living with mental illness, and the other would exempt individuals living with SMI from capital punishment if they are experiencing a mental health crisis at the time of their offense. Hopefully, these bills will be voted out of committee soon. In addition to NAMI Texas championed bills, we have testified in support of several others that would improve access to services for Texas youth, new moms, justice-involved individuals, and Texans who live in healthcare professional workforce shortage areas. A couple of bills of particular interest would extend Medicaid benefits for new moms to 12 months postpartum. With respect to youth mental health, there are a couple of bills that would require secondary schools and/or institutions of higher education to print the crisis lifeline number on the back of student identification cards. Finally, a few bills that don't relate specifically to mental health services, but we believe are important nonetheless, would ensure equity and access to public transportation, reduced fare programs for individuals with mental health concerns, improve access to telemental health services, and simplify certification and recertification for SNAP benefits for individuals with disabilities, such as severe mental illness. Although these bills aren't directly related to the provision of care to individuals with mental health concerns, we believe them essential to the health and well-being of these folks. Well, everyone, I think we've just about reached the conclusion of today's Capitol Day rally, but before we wrap things up, I wanted to say one last thank you to today's speakers, as well as those in attendance. Your advocacy is essential to improving the mental health care system in Texas. Also, a final thank you to our sponsors, AbbVie, Otsuka, and Neurocrine Biosciences. Without your support, this event would not have been possible. Many thanks. That does it, folks. Thank you for being here today and have a wonderful afternoon.